Addiction has become a very popular topic. The media is filled with tragic stories of the opioid epidemic or the accidental overdose death of a celebrity. Addiction is enslaving and killing our young people, devastating families, overstressing first responders and emergency room staff, and financially draining limited healthcare dollars. Addiction is a monster that needs to be understood and contained. Only when you know what it looks like and how it behaves will you have a chance of getting it into that appropriate cage. The purpose of this talk is to take a look into the eyes of this monster. Why does it have so much power? Why is it so hard to overcome? The American Society of Addiction Medicine's short definition of addiction states the following. Addiction is a primary chronic disease of brain reward, motivation, memory, and related circuitry. Dysfunction in these circuits leads to characteristic biological, psychological, social, and spiritual manifestations. This is reflected in an individual pathologically pursuing reward and/or relief by substance use and other behaviors. Addiction is characterized by inability to consistently abstain, impairment in behavior control, craving, diminished recognition of significant problems with one's behaviors and interpersonal relationships, and a dysfunctional emotional response. Like other chronic diseases, addiction often involves cycles of relapse and remission. Without treatment or engagement in recovery activities, addiction is progressive and can result in disability or premature death. So what does this mean? What is this disease of addiction? Addiction was classified as a disease in 1987. At that time, addiction described a specific group of individuals that were seeking help, and the medical community had some things of value to offer. The disease classification also gave a diagnostic code number to the disease for the purposes of medical billing. Unfortunately, addiction was not viewed in the same way we would view other chronic diseases like diabetes or congestive heart failure. The disease part of this condition was not well understood, and what is not well understood is easily demonized. Much of the stigma and prejudice around addiction is still present today. So if we were to take a survey today, what do you expect would be the answer to the following question? What is the cause of an addiction? Some would say addiction is a lack of moral character, and if we are honest, this would be a common belief. The addict is somehow an inferior human being and does not have the strength of character to say no to alcohol or drugs. This is seen in how an addict is treated when they present for a primary care office visit, a trip to the urgent care or the emergency department, or how they are talked about by misinformed family members. On the other hand, an addict will often present as someone who does lack moral character. This is a reflection of the brain areas affected by an addiction and not a true reflection of their character. The disease of addiction is not a lack of moral character. Perhaps it is a lack of willpower. It does take a lot of willpower to overcome an addiction, so maybe it is just a lack of willpower that allows an addiction to continue. Recent studies and brain evaluation using functional MRIs and PET scans show that this disease is a lot more than just a lack of willpower. Maybe it's a sign of acting out, some open rebellion or defiance. Even if the addiction started as a form of defiance, is that the cause of the current ongoing struggle? Is addiction a form of mental illness? Addiction is associated with a lot of irrational thinking. Perhaps that's mental illness. Is it a chemical imbalance or the result of an inherited mental illness? There is a lot of confusion surrounding the disease of addiction, confusion that must be dispelled if we are to know what to do with our suffering child, parent, patient, or friend. Addiction is a disease of the reward pathway of the brain. A disease is classically defined as an abnormal condition that negatively affects the structure or function of part or all of an organism. It is a dysfunction of the body's homeostatic processes. The body needs to be in balance to function correctly. The organ of disease and addiction is the brain, particularly the brain's reward pathway. Your brain is amazing. It consumes 20% of your body's daily calorie requirements, yet only weighs a little more than 2 pounds. Your brain is made up of more than 86 billion neurons. The brain does what it does through the movement and activity of chemical messengers called neurotransmitters. These chemicals are molecular keys that lock or unlock cell receptors that then cause a reaction in the neuron. These neurons in turn attach in a specific pattern to other neurons through their dendritic spines to form a network. The particular activation of this system will result in a thought, an emotion, or an action. If we accept the concept that addiction is a disease, it is important that the disease classification does not become an excuse to justify ongoing self-destructive behavior and attitudes or a way of avoiding personal responsibility. To use the addiction disease diagnosis as an excuse would be very harmful to both the addict and their caregivers. To use the disease as an excuse could actually prove to be fatal. We must understand what we are dealing with if we have any hope of effectively treating the disease of addiction. The problem with addiction is that it is locked up in the brain. How do we understand what we cannot see? What we do see are the obnoxious symptoms of the disease, a presentation which often limits our ability to see the disease. Medical science has taught us a lot about addiction in recent years. With the use of functional MRIs, tagged neurotransmitters, and PET scans, we now have a much better understanding of the brain pathology in addiction. So how is it possible to understand this devastating disease in terms we can all understand? The answer is memory. Addiction is a strong memory in the reward pathway of the brain. If we understand memory and how it forms, we will have a better understanding of addiction. So how do we gain an understanding of this disease of addiction? We can understand addiction better if we can understand memory and how it is formed. To understand memory, we need to understand a concept called epigenetics. Genetics, on the one hand, is the DNA that we inherit, accounting for our hair color, eye color, and so forth. Epigenetics is how individual segments of DNA get expressed in a cell. Every cell has the same identical DNA, but through epigenetics, cells perform different functions. Because of epigenetics, a muscle cell is different than a kidney cell. Epigenetics allows our nervous system to remain adaptable and allows us to learn new things. A memory is an epigenetic structural change in the DNA in the neurons in your brain. Let's take a look at how this works, first in the formation of memory and then in the development of an addiction. This is a string of partially uncoiled DNA. A stimulus causes a release of powerful neurotransmitters that directly impact the DNA in the neurons in various ways that will eventually result in the formation of a memory. This process is called neuroplasticity. Triggered neuroplasticity is the ability of the neurons to change or adjust because of a stimuli. Without neuroplasticity, we would not be able to learn or develop new memories, or as we shall see, develop an addiction. The most common effect caused by the stimuli is a process called DNA methylation. DNA methylations lead to DNA exposure. This is similar to the effect a cancer-causing chemical has on a cell that results in it becoming cancer. DNA methylation prepares the cell to change its structure and function. Also occurring is a process called PostTranslational Modification of histones. This allows the tightly coiled DNA to uncoil and expose areas of DNA that can then be modified. This tightly coiled bundle of DNA is now exposed. The cell structure and function continues to change through modifications of non-coding RNAs that remodel chromatin and facilitate or suppress gene expression. The cell changes. Protein manufacture can be turned on or turned off. The neuron has now changed both its structure and its function. You now have the structural and functional change that results in a memory or a new equilibrium. Let's take a little closer look at this process in the context of something we can all relate to, the development of different levels or types of memory. A minimal stimulus results in a short-term memory formation. These kind of memories are easily lost or extinguished. For example, what do you remember of last Wednesday? Now, what do you remember of this day? It wasn't long ago. Chances are that unless it was somehow a special day like your birthday or anniversary, you do not remember much about this day. If the stimulus is increased, the memory will last longer. This is the effect seen when you cram for exams or with major historical events, such as the assassination of President Kennedy or the first moon landing. What about this day? It happened 17 years ago. Do you remember where you were? Do you remember what you did that morning? Do you remember what you had for breakfast? Increase the stimulus even more, and now the memory will last longer, to the degree it may have a lasting, lifelong impression. You are changed by the event. You may even act differently or interpret the world differently because of this overwhelming stimulus-caused memory. Boston, April 15th, 2013. What about this day? We most likely share a different memory of this day. The yellow dot is where my wife and I were standing across the street from bomb number 2. I can remember a lot about that day. I can easily relive that moment. From what I had for breakfast to the sensation of the hot cup of hot chocolate in my left hand as we experienced the explosion across the street. I was changed by that overwhelming stimulus and still choose to not go to fireworks shows. This is how different degrees of memories are formed and stored. The process is very similar with addiction, except the area of the brain being affected is the reward pathway of the limbic system, and the magnitude of the stimulus caused by drugs of addiction are far more overwhelming than the stimulus that result in the formation of a memory. These are the major brain areas of structural and functional changes that occur with addiction. The structural and functional changes in these areas of the brain have been confirmed with several recent medical studies. One study showed that the effects of cocaine on the brains of rats changed the DNA, and there were 17 different DNA changes in 6 areas of the brain. Another study on heroin addicts that had been in confirmed recovery for over 9 years showed that major functional MRI changes when exposed to drug stimuli still occurred. Another study where subjects were given morphine 50 milligrams daily for 30 days and then followed with monthly functional MRIs showed that the changes in brain function that occurred because of the brief morphine exposure did not improve 6 months after the completion of the study. Changes in these areas of the brain have a prolonged and dramatic effect. Chemicals that can cause an addiction have their impact in several different ways, by directly impacting the neuron themselves or by massive increase in the release of neurotransmitters and the reduction in the removal of those neurotransmitters. The end result is an overwhelming stimulus to the neuron. This overwhelming stimulus affects several areas of the brain. It causes a flood of dopamine in the nucleus accumbens that sends messages to the parts of the brain saying, This is a really good experience. This is necessary. This is something to be desired. This becomes a powerful memory of desire and craving. The impact of the stimulus in the hippocampus is to enhance the memory of the reward experience. It reinforces the memory that this is something I do not want to forget. I should remember as much about this reward as possible, such as where I got it, who I got it from, the people I used it with, the room I used it in, and on and on. The impact on the amygdala is an emotional one. Now I feel secure, confident, and at peace. I have never felt this complete in the past. The impact on the prefrontal cortex is to assign a high level of value to this experience. Nothing else compares to this experience. I am willing to pay whatever it may cost to maintain this feeling. Just like the different levels of stimulus causing different permanence of memory, so the activation of the reward system, there are different levels of formed desire. A low level of reward stimulus results in a preference. I like that puppy. I like puppies better than kittens, but I don't want to pay for that puppy or pay to take care of it for the next 17 years. I experience a preference. Preferences can easily be changed, especially if you have an issue with that preference or a better preference presents itself. Just wait until that puppy chews your favorite pair of shoes. Increase the stimulus in the reward pathway and you get a desire. A desire comes from a felt need for a sense of completeness. This is the zone of operation of the advertising industry. If I can link your desire with a product that I can sell, then the sale is easy. If I can sell you a fantasy that a new car can give you a sense of contentment or acceptance, the car is sold. Unfortunately, the fantasy quickly fades with the first scratch and the first $1,000 oil change. The eventual awakening to the reality that the fantasy did not bring the contentment or sense of well-being it promised. But we still keep searching. Increase the stimulus even more, and now you have an overwhelming stimulus that requires significant brain changes to accommodate, and you end up with an addiction. This takes you past minor preference and desire into the world of craving. Your brain is telling you that you may die if you do not get the substance that produced that stimulus. This is the disease of addiction, the structural and functional changes that occur in the brain that has been overstimulated by chemicals of addiction. So now we have a better understanding of the disease of addiction, but we still have a major problem. The problem is with the presentation of the disease, the often obnoxious behaviors and manipulations of the addict. In other words, our ability to see the disease is clouded by how it presents. The changes in the limbic system not only causes cravings, but also causes characteristic self-destructive behaviors. There is a problem with abstaining. You may hear from the addict, "I want to quit, but I just can't." There is a willingness at this point to sacrifice family, friends, job, and finances just to get more of the drug. There's irrational thinking that presents in many ways. The thought and belief that the drug is not causing any harm. I can overcome this with ease. The belief that the addiction is not affecting anyone other than the addict. The fanciful belief in some kind of magical answer to life's problems, get-rich-quick schemes, or irrational beliefs about a positive future despite the current path chosen in life. When the addiction takes hold, there is impairment in behavioral control. The addict may do stupid or dangerous things to get the drug at a great personal cost. Then there is the painful cry of cravings. This may be experienced as a pain greater than any previously experienced physical pain. This then leads to increased drug seeking and increased drug use. There is a diminished recognition of problems with behaviors and relationships with eventual loss of supportive family and friends. The pursuit of the drug is now life's only priority. trust has been lost. There is a loss of standard reward capacity. Now there is only one reward, and that is the drug. Reward from social interaction, creative activity, exercise, or even good food is gone. This complexity of symptoms is the major problem in dealing with addiction. The brain changes caused by the drug does not set the stage for a pleasant interaction or productive relationships. The addict has now become their own worst enemy. The individual's presentation blinds the eyes and minds of their family, friends, and healthcare providers to the underlying disease. There is a conflict between love and trust. The addict expects you to trust and respect them when they cannot trust or respect themselves. They are hostile to the necessary boundaries that must be put in place to save their life. At this point, they are often very resistant to change. I would like to leave you with this as a picture of addiction. This is a picture of the dueling realities of addiction. What you have here is a precious little life, like all of us, full of potential and promise. All lives, whether addicted or not, are equally precious. But wait, what is that awful smell? What is that substance floating in the tub? One part of you wants to nurture this little one. The other part will make you hold your nose and run away as fast as you can. Ponder the reality of this picture, and do not throw the baby out with the bathwater. Engagement in a recovery program and living a life of recovery with a lot of hard work is highly successful. Addiction is a stimulus-caused change in neuron structure and function in the reward pathway of the brain. This is what the disease of addiction looks like. In the next talk, I will look at the necessary components of a successful recovery program. For further information or references, please consult the Fractured Resilience website. Thank you.